America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone. Hi, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker with the Job Creators Network, and today we're joined by Michele Steeb. Michele is the founder of Free Up Foundation, and she's the author of the book Answers Behind the Red Door, Battling the Homeless Epidemic. She's also a visiting fellow with Disney Institute's Fix Homelessness Initiative. And she's here to discuss the homeless crisis in America and its impact on our cities, our neighborhoods, our economy, our small businesses, and also talk about some solutions going forward. Michele, thanks so much for joining us.
Oh, thank you for having me. I'm really looking forward to this discussion, and thank you for covering it.
Well, homelessness is, a big issue. I don't think that there's really an area in the country that you can go where you don't find it. I live in Central Florida, and I see homeless on the streets all the time here, actually. Not in as big numbers as you would see in suburban cities, in cities, big cities. But I do see them, and they're holding signs up, obviously asking for money. I'm not aware of any homeless encampments here, maybe perhaps on the outskirts of downtown Orlando. But I think about, how do you actually help these people? Because me handing them $10 is not a solution. And so you founded this organization, Free Up. Tell us about the organization and what you're doing there to help with this problem.
Sure. Thank you. So if I may, I started in this work back in 2006. I was asked to step in for 30 days and run an emergency shelter for homeless women and children, and fell in love with the work. It was about to fold, and I was able to raise money and get it back up on its feet and stabilize it. But at the same time, fell in love with the work and never went back to my old job, which was running political affairs for the California Chamber of Commerce. So I ran that program for 13 years. We served tens of thousands of women and children in the 13 years that I built and led it. And what we really did was take what was an emergency shelter and build it into a program that helps these women and children change their lives over 12 to 18 months. So we had drug and alcohol counseling, mental health counseling, temporary housing, childcare, employment training. I mean, everything that they needed to become primary providers for their families, we brought on site. And that's a really important, piece of context to why I wrote the book. I wrote the book to share the answers that we had learned over the 13 years. I now live in Texas. My husband took a job here, so we had moved, but I wanted to share those lessons. I also wanted to share a roadmap for how you help someone transform their lives. And it's really important, that language I just used. We can't do it for them, but we can give them the tools and the support to do it for themselves. And that's really, really key to how we turn this around. If I may give a little bit more context, up until 2013, by the way, up until really the 50s, 60s, it was the faith-based community that really took care of the homeless. And the federal government slowly emerged, since the 50s or so, as the primary, funder of homelessness, and therefore the policy driver, the institution that said this is how you need to do it. They kind of crept into a lot of different areas that they really didn't belong in, but homelessness was one of them. And up until 2013, as a nation, we funded shelters, we funded temporary housing, we funded all the services, mental health, drug and alcohol counseling, employment training, GED acquisition, because about half or so of the homeless don't have their high school diploma or GED, at least in the population that I serve. So we funded all of that. And then in 2013, it was the Obama administration that said, we're not doing that any longer. We're only going to fund housing subsidies, housing vouchers. So we took away all of the funding for mental health, for drug and alcohol counseling, for employment training from, we kind of disconnected it from the housing. Again, those things all used to be connected. And we instead put all that money into the housing vouchers. By the way, we increased funding at the federal level by over 300%. And President Obama, during the period of this shift, and President Obama in 2013 promised this would end homelessness in a decade. And today we are at the highest point ever recorded in our nation's history, up almost 35%. And what's even worse is that, mental illness and addiction, substance use disorder, these are diseases of the brain as are classified by CDC. When diseases go untreated, they get worse. So we have basically made about 80% of the overall homeless population struggles with these diseases. So again, these diseases have gone untreated for 12 years. People are sicker and sicker because we took an approach that said those issues don't matter. All they need is keys to a house for life. And
So that was
the results.
That was the housing first model under the Obama
Yes.
administration.
Yes.
So their solution wasn't treat the root cause, as you're saying, the mental health, the substance abuse, the diseases that cause the homelessness, but simply to give them a key to a front door and say, here you go.
Yes. Now, I will say, I don't say underlying causes for a reason, because in my experience, about 50% of those struggling with homelessness, those are, mental health and drug and alcohol abuse are underlying issues. But for another 50%, a lot of trauma is experienced in homelessness, which causes you to self-medicate and again, for mental illness to get worse. So I call them accompanying issues just because for some of the population, they're not underlying. They are a result of homelessness. But nonetheless, it doesn't matter if they're underlying or accompanying, they need to be treated. And the old way was turning a blind eye to those diseases. And people, like I said, we've increased homelessness by almost 35% under this policy, and people are more and more sick. And I don't want to leave us with a dire message. I wrote the book because I am 1,000% hopeful we can turn this around. And the president, President Trump, has issued an executive order which steers that battleship in the right direction. But we've got a lot of work ahead of us to, in his executive order, he says the federal government needs to reprioritize funding for mental health and drug and alcohol treatment, needs to clear out encampments and, in some cases, use the civil commitment process to get people to actually engage in services and get them on a path to recovery. So we are so glad the Trump administration is tackling this, but I just want to be clear, there's a lot of work ahead. We have to build a system that is going to support the homeless, as we started off saying, in doing this for themselves, giving them the right tools, the right support, the right incentives. And for the vast majority of the population, they can become, really close to, if not fully self-sustaining. I would say about 70 to 80 to 90%, depending on where you are in the country. Some are going to need ongoing, a lot more support, but nonetheless, they can get better. And this executive order is moving us in the direction where we're focused on helping everyone struggling with homelessness to get better.
What are some of the elements of the executive order? Because you mentioned that under the Obama administration, the funding increased by 300%, but it sent it in a different direction versus the mental health and treatment aspects. But yet we've increased homelessness by 35%. So can you talk about some of the elements of the executive order?
Yeah, the big pieces are reprioritizing treatment, mental health and drug and alcohol treatment with federal funding, right? So not ignoring those issues any longer. And again, approximately 80% of the homeless population are struggling with one or both of those issues. So that's a big element. The second big element is saying to local communities, I mentioned earlier that the federal government is the largest funder of homelessness. They distribute most of their money through local governments, largely counties or something called a COC. I won't go into that. And so what this executive order is saying is, if you want to continue to receive federal funding, Mr. or Mrs. local community, you need to start clearing encampments, because those are very dangerous environments for the people living in them. They're very dangerous environments for the people living around them. Just in the last month, we've seen Irina in North Carolina, right? The gentleman who stabbed her so viciously, killed her on the metro. He was homeless. He had a long history of mental health struggles. His mom, his brother reached out for help. The system didn't help him. So we saw that horrific incident. And right before or after that, I can't remember, there was a gentleman, again, long history of prior engagement with law enforcement, given his mental illness and criminal activity. This gentleman was 27 years old. In the span of one day in Central Park, he nearly bit someone's ear off and set two people on fire, innocent victims. So we can't continue, the way these encampments are often run, it's horrific what's happening to people. They're experiencing violence. Women are being raped. They're being trafficked. Pets are now dying from overdose in encampments across the country from fentanyl. These environments are horrible. And what the president is saying is, we're reprioritizing funding to treat mental illness, to treat addiction. And you, Mr. or Mrs. local community, need to move people from encampments into those programs that we're going to be funding so they can get the healing and help they need.
That was my question. I have seen some of the encampments brought down in Washington, D.C. with the president's cleanup and his, trying to get rid of the crime in D.C. Where do the homeless people go when those encampments are brought down? Because I've heard people say, well, where are they going to sleep tonight now? So is it part of the bringing down of the encampment that they go in and bring those people into, a temporary shelter or a treatment center? Is that what happens, or they just scatter throughout?
Well, the intention has been, I haven't seen any data out of DC since they started that process. The intention was to lead them into treatment, into programs that offer treatment, that offer temporary shelter. Again, I haven't seen any data, but I will caution everyone in saying that we don't have nearly enough capacity, because until this executive order, now we need to build that capacity, right? The Obama administration, the housing first approach, there was no funding for the treatment portion of the system that's needed. And so a lot of those programs went away they morphed to the housing first model. So we need to rebuild a lot of capacity that was went away under this approach. So we've got a lot of work ahead, but thankfully this administration has turned the battleship in the right direction.
And that's your approach versus the housing first. You have the human first approach. Tell us about that.
Well, it's looking at an individual and saying, what has led you to this point, right? We got to think about this when those struggling with homelessness, and it's somewhere probably around 2.6 million Americans, even though HUD data says it's only about less than 900,000. I won't go into that unless you want me to. But when those folks were in first grade and the teacher, said, what do you want to be when you grow up? I would lay down on railroad tracks to say that none of them raised their hand and said they wanted this kind of life. They took a wrong turn or a series of wrong turns and didn't have the family support, maybe because of their own actions, maybe because, of generational poverty issues that exist a lot in this community. But they don't have the support to to get them back on the right course. And it's very, so even though I hear a lot of, oh, well, they want to be homeless, the reality is they never wanted this for their lives. And right. We need to help get them back on that path. Human beings innately need to be productive. We need to help them be productive again, to realize their full, human potential. That productivity requires responsibility and accountability, but you can't just assume that they know they can, function without support and tools to get to that point where they can take responsibility. So we've got to start small. We've got to start at the individual level. What's led you here? Once we understand that, we can start to give them the services and the tools and the support they need to, and it's not an overnight process, right? I mean, it really took us at the program I ran about 30 days to really understand the human beings that we were dealing with. And even though they might have told us what they thought led them into this situation, in 30 days, we had a much different, more clear picture than they may have been able to provide at that point. And then even then, for again, a large portion of the population struggling with addiction, you need to say, okay, let's just focus on being sober for an hour, and then let's, focus on a day, and then let's focus on a week. And you got to start, small. But once they develop capacity and once they develop habits and confidence that they can do this, that's when you start to really see the accelerated progress. And in our program was 12 to 18 months. Some women were able to complete it in 7. Some needed 24 months. As long as they were making progress, we were willing to support them. And that's the kind of system we need to build, the human first system that really helps them realize their full human potential.
I mean, I think that's great because, we've seen, crime increase across the country for various reasons. Obviously, mm-hmm. We've seen no cash bail passed in many cities, and that's led to it. Obviously, it led to some of these mentally ill, homeless folks, like the one you referenced in North Carolina. Those soft on crime policies led to him continuing to be let out. And I believe I read the last time he was in front of a judge that he was let go by promising he would go check himself into a treatment center.
That's exactly right.
All I thought was, with what money? with what insurance card did this judge think he was going to check himself into? But it was on his own promise.
Yeah.
that he would check himself into a center. And unfortunately, there's a young woman who's not alive today because somebody didn't take the initiative. This judge didn't force that to happen in some way or another. I think there was also the issue in New York with Daniel Penny, who
Yes.
unfortunately, took it into upon himself to restrain a homeless person who, people were afraid of and was known in the subway system to make these kinds of threats. And Daniel Penny took him seriously. I took him at his word for it. But this is happening more and more, and it is scary. It spills into our communities. The
Yeah.
crime, the drugs. I know that San Francisco is kind of the city you see highlighted in the news across the country because they're the encampments, the crime, defecating on the sidewalk. I've seen small business owners interviewed saying, I can't, nobody comes to my store because I've got all of this happening right outside, every morning. And, it does hurt communities economically as well. Can you talk about
Yes.
some of the impact there?
Yes, absolutely. So, just using San Francisco, gosh, there's so many things I can talk about, but so many businesses. I grew up going to San Francisco many times a year because I lived in the Bay Area. All the major retailers, have left the city. Not just the major retailers like Target and Macy's and Gumps and all the places that we used to frequent and that people used to identify San Francisco with. But even the grocery stores are closing up because of the theft. They can't keep up with it. They're not allowed to, prosecute in California, as you know. You could steal up to $995 or $990, and no one could do anything about it. They just had to watch them walk out of the store. That has been repealed by ballot initiative, but Gavin Newsom, the governor, has chosen not to fund the enforcement of that ballot initiative. So it's just devastating what's happened to the businesses there, which affects the community, because now you have to drive a long way to find a grocery store that you can get groceries at, or a department store that you can get whatever you need at. Also, San Francisco was, even though, and let me step back and say, there's a Housing First is part of a movement called harm reduction, which means, don't do anything that's going to cause harm to the person, which sounds great, on its surface. But in North America, we practice harm reduction in a very progressive, detrimental way. It's really a movement that came out of Europe, and we just take it to the extreme here in the United States. So, as an example of harm reduction, there's something called safe injection sites. I don't call them that. I call them supervised drug consumption sites. They're illegal in the United States. However, the Biden administration in the last 4 years was turning a blind eye to the emergence of these sites in the United States. There's 4 in New York right now. There was one in San Francisco. It caused, and I say was, after a year, it caused such an uproar in the surrounding community that they held elected officials' feet to the fire and made them close it down. This, you saw people having sex, outside of this encampment. People were obviously injecting illegal drugs with support from the people running the safe injection site. You saw crime increase there, and let me ask you to guess how many people. The way it's supposed to work, the way it's practiced in Europe, is when someone comes into a safe injection site, again, I call it a supervised drug consumption site, you're supposed to build relationship with them and do everything you can to lead them to treatment. How many people do you think were led to treatment in the San Francisco site after a year?
I mean, it's got to be zero.
Well, it's 0.8%, right? And there's no tracking of, whether or not they even stayed in treatment. That's just that they, made a call or something. So it's a real disaster. So, impacts such as the, kind of permissive drug culture under harm reduction, which is, again, Housing First is a part of. It's just been devastating to businesses, to communities. We talked about the violence that has resulted in I mean, we use the example of Irina in North Carolina and the gentleman in Central Park, but it's all over the country. And then let's talk about the environmental impacts. Where are the environmental groups that are watching we're talking about millions of pounds of trash being cleared
Right.
from these encampments, trash that's going into rivers, and needles that are very, very dangerous for people to be stepping over. Pets are overdosing now on fentanyl across the country. Where are the animal rights groups? The women are being trafficked. They're being raped on regular basis. There's no where are the women's groups, right? Where are the pets groups? Where's PETA? Where's
Well, isn't it an
where are the
admission?
environmental groups?
Wouldn't it be an admission that the direction of the Obama administration that increased funding so dramatically wherever that funding is gone, wouldn't it be an admission by all those groups that it failed, that what they've done is failed? And that's just unheard of, that there would be an admission of failure.
Yeah, and you're so right. So none of them, are coming forward. They're all hiding, and no one's calling them to come forward. But let me give you a glaring example of this. So I mentioned the president's executive order that he issued, about 4 weeks ago. The single largest homeless advocacy group is called the National Alliance to End Homelessness. They are suing the Trump. They are fully behind Housing First, and it's epic failure. They have just filed suit about a week and a half ago against the Trump administration for trying to fix this. It's crazy. They
Well, you
they
just have to
they
follow the money there, Michelle. I mean,
yes,
you just have to follow the money there, and
yes.
how much money are they now not going to get for the policies that they were supporting with the Housing First versus what the Trump administration wants to do. So you just have to follow the money to find out what the agenda is there. But when you look at the results, that's what I would say. If that case came before me, I would say these are the results. You've failed. You get an F.
Yes. Yeah, but for I 1000% agree. It's just that for the single largest advocacy group to be saying, because what they're saying in essence is, we defend what's been happening the last 12 years. We defend the fact that it's gone up 35% despite the promise it would be ended in 10 years. We defend the fact that the death rate amongst the homeless population has gone up 77%. We defend the fact that spending is up 300% and it's done nothing to solve the problem. They're, in essence, defending failure and devastation to the homeless, to communities across the country, to businesses. And it just drives me bananas that no one is calling them out on the carpet for what they're defending, which is failure.
Yeah, I think it's absolutely pathetic that that you have the largest organization doing that. I mean, the reality is they can still benefit from government dollars flowing their way if they would just follow the reprioritization of what the administration wants to do. And why not try something different? I mean, what's the definition of insanity? Why not be open to a different way of doing things when a new administration comes in? I get so frustrated with people who get so set in their ways instead of saying no, say yes. Say
Yes.
yes to change and say yes to a different way of doing things, because maybe it will work and maybe it will make a difference, because there are real people who are suffering as a result of this. We have communities that are, disgusting to be in, that make it impossible for, families to grow and small business owners to contribute to. I mean, there's 33 million small business owners in the country, and they are our neighbors. They support our little leagues. They contribute to our communities. They run for mayor. They're on our city school board councils. I mean, these are people who are invested in communities. And I'm sitting here listening to you and I'm thinking, how could the small business community, which is so big and so diverse, they're diverse, through race. They're diverse by political parties. They're diverse by industry and what they're doing, by size. There's so much diversity there. But I feel like as they are in these communities, what they end up doing is fighting their own government, say in San Francisco, for example, just to stay in business, just to keep from not having $900 a day stolen from them. But if you looked at how you could draw in the strength of a community like that, it would be massive. It would be a massive movement beyond some C3 organization that is fighting the administration that is trying to make a change on what's failed for 12 years. So I sort of put that on you surprisingly to say, there is a community out there that's big, vast, has lots of resources. They're super entrepreneurial, and they may have solutions that exist. And maybe there's opportunities there to tie into saving these homeless people by tapping into entrepreneurs who think of new ways to do things all the time.
Yeah, I think you're exactly right. And one of the points I often make is when, local communities, because again, most of their money to address homelessness rather, comes from the federal government. So they've been under the thumb of this housing first mandate. They've not been allowed to innovate. They've not been allowed to design a system that really addresses their unique population, right? Homeless populations look very different in different parts of the country. And that's why we started Free Up Foundation, a team of people and myself, to really help a region turn this around in 5 years. And we're really looking forward to working with regions who want to do things differently, who are excited about the opportunity to create a new model, a much more effective model. And I promise you, earlier you said, why not try something new? The model that we developed at Free Up is based on the tens of thousands of women that I watched who came, to us at the depths of despair and have risen and are now, some are homeowners in California as single mothers. They're working, they're thriving in their roles economically, and their role as moms. And this absolutely can be turned around. But again, the local communities have been under the thumb of this mandate for so long. They don't know how to turn it around yet. So we need to help them do that. And it is absolutely possible to turn it around. I'm 1,000% confident in that.
Well, I go to a lot. The reason why I'm sort of just trying to think outside the box is I go to a lot of chamber meetings around the country, frankly, because we're a national organization. And so I do look at what chambers are doing. And when I speak at chamber meetings and I meet people, the diversity of the people and the organizations that show up to these meetings is always interesting to me. I've had people who are running like gambling anonymous treatment organizations, women's shelter organizations, women and children, women of abuse situations, and things like that. And so I have seen the outreach and the connection between the small business community and organizations like that. So I think they do see that kind of strength. And so if now that the funding is changing and the prioritization is changing because of the executive order of the president, I do think there are opportunities, and I think there are probably pockets around the country that see the opportunity to partner with business communities. Either maybe there's, job type, a pipeline of jobs as well, and maybe that's farther down the line past the treatment. So I see that, and I've always thought, that's interesting that a woman's shelter is at a chamber meeting, or something like, organizations like that. And I have found that interesting. Have you come across those types of partnerships in the work you've done over the last 10, 12 years?
Oh my gosh, yes. I was super active within the business community in Sacramento as I built St. John's. Of course, I came out of the chamber world. That's where I was before joining St. John's. But when I started at St. John's, we were about 90% reliant on government funding, and I wanted to change that immediately. It took a while. It took several years, but when I left, that same amount of government funding would have represented 10% of our budget. We really worked to diversify our investment, largely through relationships with the business community, but we also started 3 employment training programs that serve the public. So 2 restaurants and a catering program and a daycare program. So our women worked in those programs, but the public, gave us the business to give them the training. So that also helped really diversify our funding and bring in a lot of support from the community that we wouldn't have otherwise gotten. But it's very crucial. Government shouldn't be the largest funder of this. They weren't, as we talked about earlier, up until a couple decades ago. We really need everyone at the table, but we certainly don't need to be driven by the whims of government, as we were back in 2013 with the one-size-fits-all institutionalization of housing first.
Well, I think we could talk for several hours on this. I find it very interesting. It's an area that I didn't know a lot about, but I started looking into it when before you came on, and in the lead up to this interview. And I want to thank you for everything that you're doing in this area, because it is very sad that people find themselves out there. And you're so right. They didn't sit in first grade and say, this is the life I hope I get to lead when I'm older. Yeah. They wanted to be veterinarians, or they wanted to be Superman, or something along those lines, but they certainly didn't want to be homeless. So your organization, Free Up Foundation, where can people go to find out more about what you're doing and support what you're doing?
Thank you. And we definitely need the support of the public. So freeupfoundation.com. Also, my book, Answers Behind the Red Door, Battling the Homeless Epidemic, is available at Amazon. So if y'all are interested in reading more about, how we got here, we covered a lot today, but how we get out of this situation. It's a short read and very impactful. So yes, but freeupfoundation.com has a great website, growing website, and my website where I write a lot about this issue as well is my full name, MicheleSteeb.com.
Well, Michele, thank you so much for taking the time to join us on Main Street Matters, America's small business megaphone. Thank you all for taking the time to tune in again. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show wherever you get your podcast from, and we'll be back soon with another episode. Bye for now.